Acute glomerulonephritis. What are the common symptoms and how is it diagnosed? A comprehensive overview for medical students, doctors, and other healthcare professionals. Questions and answers. Question: what is acute glomerulonephritis, and how is it characterized? Answer: acute glomerulonephritis is an inflammatory condition of the glomeruli in the kidneys. It's characterized by decreased glomerular filtration rate, GFR, oliguria, hypertension, active urine sediment, and proteinuria, which is rarely in the nephrotic range. Question: how is decreased GFR related to acute glomerulonephritis? Answer: decreased GFR in acute glomerulonephritis reflects a reduction in kidney function. It's a result of inflammation and damage to the glomeruli, leading to impaired filtration of blood. Question: what does oliguria indicate in the context of acute glomerulonephritis? Answer: oliguria, or reduced urine output, in acute glomerulonephritis is a sign of decreased kidney function. It results from the reduced GFR and can be a manifestation of more severe renal impairment. Question: how does hypertension develop in acute glomerulonephritis? Answer: hypertension in acute glomerulonephritis is often related to fluid retention and activation of the renin-angiotensin-aldosterone system. The impaired glomerular function leads to volume overload, contributing to elevated blood pressure. Question: what is meant by active urine sediment in acute glomerulonephritis? Answer: active urine sediment refers to the presence of abnormal elements in the urine, such as red and white blood cells, casts, and possibly renal tubular cells. This finding is indicative of glomerular inflammation. Question: why is proteinuria rarely in the nephrotic range in acute glomerulonephritis? Answer: in acute glomerulonephritis, proteinuria is usually subnephrotic because the primary damage is inflammatory rather than structural. The glomerular basement membrane typically remains relatively intact, limiting the loss of large proteins like albumin. Question: how is acute glomerulonephritis diagnosed? Answer: acute glomerulonephritis is diagnosed through a combination of clinical assessment, laboratory tests including urinalysis, serology, and kidney biopsy if necessary. The presence of the described findings is crucial for the diagnosis. Question: what is the typical management for acute glomerulonephritis? Answer: management of acute glomerulonephritis often includes supportive care, blood pressure control, dietary modifications, and treatment of the underlying cause, such as infection. Immunosuppressive therapy might be needed in certain cases. Question: what complications can arise from acute glomerulonephritis? Answer: complications of acute glomerulonephritis may include acute kidney injury, chronic kidney disease, hypertensive crisis, and electrolyte imbalances. Question: how is patient prognosis determined in acute glomerulonephritis? Answer: prognosis in acute glomerulonephritis depends on the underlying cause, severity, early diagnosis, appropriate treatment, and patient's overall health. Some cases may resolve completely, while others might progress to chronic kidney disease. Further information. For a comprehensive understanding of acute glomerulonephritis, including its pathophysiology, diagnosis, management, and long-term implications, students and professionals are encouraged to consult nephrology textbooks, current clinical guidelines, and peer-reviewed research articles.